Hey, good morning, everybody. Thanks for joining us in our self-organized Colombia, Asia, Petaling Jaya self-organized virtual antenatal workshop for this year, 2021. Okay, so I'm Nicholas Lim. I'm the consultant obstetrician and gynecologist in Colombia, Asia, PJ. So some of you probably have followed my Facebook page and have actually attended some of our previous virtual webinars. Okay, so as for this one, the topic, like what Valerie has mentioned earlier on, how to optimize my chances of a successful childbirth, and obstetrician, from the obstetrician point of view, from my point of view, from me to you. Okay. Right. Okay, so yep, this is a photo of where we are streaming from. Okay, Colombia Asia Hospital PJ along Jalan University, or the name has been changed already. The new name is let me see, Jalan Professor Diraja Unku Aziz. Well, such a mouthful, isn't it? So get used to it eventually. Okay, so this is a disclaimer. Just go through it yourself. All right, so for today, we do not have much time. We probably have about an hour or so, all in all, together with a Q&A. Talking about Q&A, what I'll suggest is that you just list all the questions down, and then during the Q&A session, whatever time that I'm left with, I'll try to go through everyone, okay? Unless some that I've mentioned, I will probably skip it. So due to the time constraint, I would just focus mainly on the second trimester, third trimester, together with the labor and delivery today. Okay, the preconception part, first trimester part, postnatal part, I'm afraid we won't be able to cover. Probably these other topics, I will do it in other webinars whenever we have the chance. Okay, pregnancy, trimesters of a pregnancy. As we all know, pre-pregnancy, first trimester, second, third. First trimester is from the beginning till 13 weeks, 6 days, okay, strictly speaking. And second trimester itself is from 14 weeks up to 27 weeks plus 6 days. Third trimester itself is from 28 weeks to when you birth your baby. So how frequent do I see my expected moms? Okay, from the beginning till up to 28 weeks, if everything is normal, I'll see them every 4 weeks. Okay, 28 weeks to 36 weeks, meaning about 7 months to about 9 months, I'll be seeing them every 2 weeks. And the final 4 weeks itself, or till the birth of the baby, will be on a weekly basis visit, because at that point of time, we would need to monitor things more closely. Okay, this is the food to avoid during pregnancy. There are a lot of questions on what food should I take, or what food should I try to avoid. Okay, I'm not trying to sound like a grandmother, but these are the things that scientifically proven, and also from my observation, that yes, you shouldn't be consuming too much of these food. Okay, so let's start with the first one, this part, the green part. Okay, raw and uncooked food. I think common sense would tell you that, isn't it? Because there'll be a lot of bacteria and organism in it, which may harm your health and also the baby in your womb. Okay, raw uncooked meat, fish, so no sashimi. I don't think so Malaysians would be eating raw meat, though there are like people take beef tartare and all, yeah, but not really our local diet. Sashimi, okay, one of the godsend food. Okay, I love it myself, and I think a lot of expected moms love it too. So I would advise to avoid this one, okay, because it's still raw food. There will be some organism there. You don't want to end up with some food poisoning. Okay, eggs. Lately, there's a lot of big news about eggs in certain farms that have been rejected by certain countries. So yes, raw eggs, avoid. Soft-boiled egg, half-boiled egg. You cook the egg fully, fried eggs, scrambled eggs. These are all fine. Milk. Okay, milk, if you're talking about pasteurized milk from the supermarket, those are fine. What I'm mentioning is milk directly from the farm, you're not sure whether they have been properly pasteurized, try to avoid those, okay? And their byproducts mainly is like cheese made from unpasteurized milk. Shellfish. Shellfish is basically siham lala or kerang, these sort of things, because they may actually harbor a lot of bacteria as well. We don't cook it well, or they have been contaminated. So someone's sharing their audio as well. Valerie, you can just check or not, please. Okay. Yeah. So they may harbor some what do you call heavy metals, okay, such as like mercury and ginseng and its byproduct. Okay, this is my favorite topic. So ginseng, usually from the Chinese community, some mothers, the well-meaning mothers and mother-in-laws do actually advise their daughters or daughters-in-law to take lots of ginseng so that they have a lot of energy while they're birthing their baby, so they can actually birth their baby easily. But studies have shown that ginseng, they do contain certain products or byproducts that will thin out the blood. So if it's consumed at an excessive amount, in an excessive amount, it may actually cause bleeding during childbirth. So I would advise just avoid ginseng, especially those that they actually grind it into powder and put it in capsule and ask you to take a few capsules a day. Or sometimes while you are birthing, they will ask you to take a few slices, put it in your mouth, chew on it while you're birthing. So please do not. I've had experience moms doing that. Somehow or other, I've told them they still do it, and they end up with pretty bad bleeding after birth. Okay, coffee and tea, I'll just put it in moderation. This one mainly is because of the caffeine. If you can avoid it during the first trimester, try to avoid it. If you can't, just keep it like probably a cup a day will do. Okay, because sometimes withdrawals from caffeine is really no fun. Okay, and activities, these are the activities to avoid sauna, steam bath due to the excessive heat. That goes for prolonged sunbathing as well. Reflexology, normal massage, prenatal massage, if it's done under the trained hands, these are okay. Reflexology are like this one, okay? Because there are a lot of meridian points in the what they call the sole of our feet, okay? So if someone actually triggers certain meridian points, which may trigger out a contraction, then the effect may be a little bit nasty, okay? So try to avoid reflexology. The massage of the scalp, shoulders, hands, thighs, back, these are all fine. Okay, and it goes without saying, the last two, smoking, alcohol, recreational drugs. Alcohol, probably not that much, but smoking, certain moms, they can't give up smoking. So I'll ask them, try your very best to reduce it. Once you can reduce it, quit it straight away, okay? So, and recreational drugs, definitely a big no-no. Okay, sleeping position. Before 20 weeks and after 20 weeks, I put it here. Okay, before 20 weeks, the womb is not too big, meaning the baby is still quite tiny, less than 500 grams, together with the placenta, the fluid, the womb. It may not actually weigh that much yet. So at this point of time, I would advise, mom, up to you, you can sleep in whatever position you like, okay? But if you are after 20 weeks, I'll advise you to lie flat, avoid lying flat on your back, okay? Try to tilt yourself either to the left or to the right. If you sleep on your side, it's fine, okay? And a lot of mom ask me, why do we have to do like that? As I've mentioned down there, to avoid compression on the big vessels, okay? Mainly your vena cava and your aorta. It's just imagine if you yourself, okay, you're breathing through a tube and the tube is connected to an oxygen tank, okay? And you're stepping on the tube. It's a long tube. You're stepping on the tube while you're breathing in. Do you think you'll be able to breathe in any oxygen? No. So it's the same thing as well. It's like baby, it's pressing on its own blood supply, providing baby oxygen and also nutrient. So for some moms that they are not side sleepers, I'll ask them to start training themselves, okay? from even before 20 weeks. Even like 14 weeks, 16 weeks, you can start training yourself to sleep more on the side, okay? Left or right, doesn't matter. Use more pillow to help you to support yourself. Okay, and some moms, they actually do use this pregnancy pillow, but this is a huge pillow, okay? You can see it's probably bigger than the mom. If you are just sharing a double bed or queen size bed, if mom is here, pillow is here, where's the dad? The dad may need to sleep on the floor, okay? So bear in mind, before you purchase this, it's a huge thing. And certain moms, they enjoy it. Certain moms, they use it once and twice, they just chuck it on the side. Okay, so like I've mentioned earlier on, so if you tilt it on the side, it doesn't compress on this vena cava and the aorta, the great vessels. But if you're lying flat on the back, baby is actually stepping on his or her own blood supply. Next, still on the topic of sleeping, insomnia, sleeplessness, you're unable to sleep. A lot of moms experience this, okay? Why? For whatever reason, okay? One thing is that the belly is so big already, it's so heavy. When you move or when the baby moves, it wakes you up, okay? So definitely it's going to cause a lot of heat and discomfort, and it's totally uncomfortable, okay? Those that are in the third trimester, you can vouch for it. And the need to wee at night, okay? This one can even start from the first trimester because the growing womb is just next to the bladder, your urinary bladder. So it actually does press on it and cause you needing to pee. So what I'll suggest is that probably not drink too much an hour or two before bed, and pee right before you go to bed, all right? The third is leg cramps, snoring, and congestion. Okay, it can either be from the mom or from the dad as well. As we all know, pregnant ladies, there's changes in their tissues, in their internal organs. So things are edematous or it got swollen up. So sometimes it's easier for them to snore and get congestion while they're lying down. Worries and anxieties, all moms have it at some point of their pregnancy. Okay, way to tackle insomnia. Okay, have a nightly routine. Okay, try not to do different things different nights if you can help it. Okay, if you're the type that, okay, after watching TV up to 10 o'clock, then or before that you take a warm shower, then turn on the aircon, dim down the lights, have a nightly routine, 10 o'clock, then 10 o'clock go to bed. Okay, try not to do too much things on the bed itself. Reserve the bed or the bedroom for sleep alone. Okay, avoidance of caffeine. I know some people, even after lunch, if they take caffeine, coffee or tea, they are unable to sleep that night. Okay, avoidance of spicy food. Spicy food may actually cause reflux in pregnancy. Prepare your bedroom, like I've mentioned just now. Turn on the aircon, dim down the lights, make it as comfortable as possible. Prepare yourself mentally. Okay, and if can avoid, no one would actually prescribe an expectant mom sleeping pill. So this is a big no-no. Try not to be reliant on it. Okay, earlier on from the previous speaker, they have mentioned there was some question about constipation in pregnancy. Probably here I'll elaborate a little bit more on constipation in pregnancy. It is common. Okay, constipation is common in pregnancy. That's due to the bodily changes. Okay, the change in the hormone, pregnancy hormone, which slows down the movement of the gut. Okay, so your gut doesn't move as well as during the non-pregnant stage. So that's why the transition of the poo will be slower. And also moms, they do take iron supplements, okay, to build up their blood cells. So iron does actually harden up the stools as well, the poo, and two things really. Slow translate, a harder, bigger bulk, okay? That's why it makes everything slower. It's a distressing situation, okay? And a lot of moms, they spend like probably sometimes up to an hour sitting on the toilet bowl, straining themselves and all, and finally leading on to hemorrhoids, okay? I mean, to begin with, pregnancy is associated with worsening of hemorrhoids. But if you add on straining while pooing, that will be worse. Okay, how to overcome constipation? Okay, this is what I always advise my expected moms what to do. Plenty of fluids. Okay, I'm talking about fluids. I'm not talking about water. Okay, some people when they take water alone, they just can't. Okay, but fluids means water, juices, soup, no alcohol. Okay, these three things. So sometimes if you think that plain water is too bland, add a little bit of fruit inside, mint, lemon, make it more palatable. If not, then you can have juices as well. Make sure the sugar level is not too high. High fiber diet, oats, rolled oats. We're not talking about the sweetened ones, just those that comes in a pack. Doesn't taste that good. You have to cook it yourself. Have it 2-3 times a week. It does work. Okay, even on non-pregnant moms as well, they do work. And fruits, the good ones: kiwi, dragon fruit, guava. These are the berries as well. These are the good ones. And vegetables. Lots of vegetables to build up the bulk. Okay, routine-like exercises. This will help the body and its organs to function better. Probiotics. This is to improve gut health. If possible, smaller portion of iron supplements. Usually, whenever I prescribe my expected moms with supplements, multivitamins, I try to start with those with lower irons. Okay, if let's say later on in the pregnancy we notice that mom's blood level is still low, she's still anemic, then I would add on a little bit more. And whenever possible, I'll try to introduce those that doesn't cause so much constipation or discomfort to the mom. And worst comes to worst, if all doesn't work, come to us. We'll give you some stool softener as and when. Okay, this topic a lot of people want to ask, but they're not asked. But I even put it on my pregnancy advisory for those moms that come to see me. Okay, sex during pregnancy is generally okay. All right, you won't cause premature birth. You won't harm the baby. You won't knock on the baby's head or anything. Okay, so but no sex if there is pain, bleeding, or the water has broken. Okay, these three things just bear in mind, mom and dads. Okay. Well, if you have more questions, you can ask in the Q&A later on. And many couples, they do keep pets, okay? They are furry children, okay? Even before they have their own children. Okay, so, I mean, if you have been keeping your furry child for the past 5 years, suddenly you get pregnant, you don't just give up your pet dog or your pet cat, isn't it? Okay, so how to incorporate these two together? Okay, well, pets can sense pregnancy. I do believe in it. Whenever there's bodily changes, or I don't know, maybe changes in hormone and all, they do come and sniff on your tummy. Okay, and then introduce your pregnancy or your baby to them gradually. Okay, I mean, almost never your own pet will attack your baby. Okay, but do introduce them gradually and take some precautions. And also large pets. This is especially when you're pregnant. It happened to one of my moms a few years back. Big dog, small size mom, pregnant, wearing high heels, about to go out. The dog was about to go out, come back, I can't remember. Dog was very excited. Jump on her. She lose her balance. She fell. But thank God nothing happened. Just landed on her buttock. So be a little bit cautious when you are small, your pet is large. Okay, and sometimes to certain babies, pet dander may cause allergy. So if you want to keep both of them together, make sure that you keep the environment clean, clean that up regularly. And the most important one for the cat lovers, the cat litters, meaning the poo of the cat. Try to avoid handling it yourself. Okay, ask your hubby to handle it, because cat poo does contain this particular parasite called Toxoplasma gondii. It may cause toxoplasmosis. Okay, it's a nasty infection, not so much to you, but to the baby. Okay, you want to read more, you can read about it. Okay, so if you have a cat litter and all during pregnancy, put it aside, ask your hubby to clean it up. Your cat itself and all, you can handle the cat, shouldn't be a problem. I mean, wash your hands, okay, before you actually use your hands to eat or anything. Okay, next one. This is for someone who wants to pamper themselves from time to time. Spa and massages, okay, it's generally safe for pregnant or expectant moms, okay? So like I've mentioned earlier on, avoid massage on the tummy and reflexology, okay? Do indulge yourself, do it on a monthly basis if you want it, okay? It's a form of relaxation. I know that pregnancy, it's a stressful journey to some people, okay? So take some time off, listen to some or indulge in some positive vibes in the spa and get some prenatal massage. It's all therapeutic. Facials, hair treatment, generally safe as well. What I'll advise is to avoid retinoic acid, the peeling kind of facial, and laser. Okay, coloring and highlighting, generally it's safe. If you're worried, do it after the first trimester. Okay, and tell your stylist if you can get the lowest ammonium content one or the as organic as possible. Okay, and generally it's safe. It won't cause an abnormal baby and all. Okay, I mean, you're just doing it probably once every like what 3 months. In your whole pregnancy, probably you're just doing it twice. Okay, yeah. Okay, stretch marks. What we call medically we call stria gravidarum, the badge of honor. Okay, I'm not advertising any of this product, but certain products are quite good. Okay, I'll name maybe 1 or 2 that usually it's very well tolerated, well liked by the moms, and it does work as well. And remember, all these products, it's meant as a preventive measure. Okay, before it happens, you apply it. When you apply it, probably apply it at least twice a day. You can go up to 3 or 4 times. If you're showering in the middle of the day, do apply it after that. Okay, but at least apply it twice a day. And not after when you have started seeing this, then only you start panicking and start applying. It does not work really at that point of time. Okay, traveling during pregnancy, unfortunately, for the past, I think more than a year, almost a year, we haven't been able to travel much really, especially, I mean, definitely overseas. I mean, domestically also, even I myself, I haven't been flying. My last flight was January 2020. Okay, traveling generally safe in pregnancy. Okay, so as long as before you embark on the journey, I'm talking about flying, not driving and all. Okay, there's no plane, no bleeding. Get a letter from your doctor, at least I think 1 week before you're flying. Make sure that you're well. Okay, and during a long flight, keep yourself hydrated, mobilize. Pressure stockings, probably not that much. I would say do some leg exercises, mobilize yourself, walk around, ambulate around the cabin throughout a long flight. I'm talking about like European flight, 12, 13 hours. Just move around. Pressure stockings are very uncomfortable, cause itchiness, and it's very warm. Okay, this topic, since we are talking about traveling, you cannot travel, it's due to this particular thing. Okay, so a lot of moms may actually want to know a little bit. So the next couple of slides, I'll be dwelling a little bit about COVID-19 and also the vaccine. Okay, so expected moms, pregnant moms, you do have lower immunity as compared to other adults, the non-pregnant adults. So let's say husband and wife, they go and have a hot pot. Okay, you know hot pot, sometimes you put the food in there, it may not cook well, and then you start taking it. If you're cooking yours well, suddenly your hubby is like, before you take it out, like 5 seconds before you take it out, he puts something in. And his is not properly cooked yet. And probably from that particular meat, okay, has a little bit of bacteria in it. And then you are scooping up the soup together with your food, yours is cooked ready and you eat it, and you may get it. Okay, so you and your hubs are taking it, but you may not get it. He may not get it. You may get it because your immunity is much lower as compared to him. So that goes for COVID-19 as well. Not that pregnant lady is easier to get it. Everybody's risk is the same, I would say. But if a pregnant mom were to get it, especially in the third trimester, the risk can be very serious. Okay, there's an increased risk of admission to ICU. Okay, not only admission, I mean to ICU. That's quite bad, really. And also, there's an increase in the death rate. Okay, and as for pregnancy itself, there's risk of premature delivery. Okay, and also, if a mom has COVID during labor, okay, the mode of delivery at the moment in the Malaysian national guideline is cesarean section, unfortunately. Okay, so expected moms, you need to be protected. We need to protect all the pregnant moms. Okay, how do we protect them? Okay, either the mom gets the COVID vaccine, high risk group. I'll mention later on, only certain people get it. I'm not advising all pregnant moms. Please don't run to your nearest clinic or hospital demanding for your COVID vaccine. Okay, and the main thing is that vaccinating those people close to them. Okay, if they themselves, they stay at home, they don't go out and all those things, very good, abide to SOP, but the people around them, if they were to contract it and pass it to them, unfortunately, they will fall into this category. Okay, so like I've said, if you still haven't done it, register yourself on my Sejahtera app. I don't know when you're going to get yours. Even for me, also I've just gotten my first dose, and next Thursday I'll be getting my second dose. Pray, hope, all well. First dose, all good. Just a little bit of soreness for about half a day. Otherwise, it's good. Okay, it's nothing like those scary stories that we have heard. Okay, let's talk about a little bit about COVID vaccine. Okay, for pregnant moms. I think Malaysia we have gotten in about at least 3 to 4 brands of vaccine already. Okay, so generally, pregnant moms are excluded from this vaccine, this COVID vaccine. But these two, this one, the red ones, these two groups are offered COVID vaccine. Moms with serious medical illnesses, or they are very immunosuppressed, okay? Or if you are on the medical frontliners, okay? Nurses, doctors, or those working in the hospital, you may be eligible. This one is updated March 2020. And the administration period during the gestation is between 14 to 33 weeks. And also these following groups, it has been mentioned in the guideline as well, may be eligible for the vaccine. Okay, but at the moment, we are not routinely vaccinating these pregnant moms. Okay, over 40, severe anemia, diabetes mellitus on insulin injection, and smokers. All right, if smoker, stop smoking. Okay, so COVID vaccine does not protect an individual 100%. Okay, you may still get it. Okay, but if you were to get it, the symptoms will be reduced. Okay, it prevents the admission to ICU and also reduction in the death rate, and it reduces your infectivity rate. Okay, you don't infect other people so easily. All right, so remember, adopt your 3 Ws and avoid the 3 Cs. See whether I remember or not. Close conversation, confined space, and can't remember. No mind, you go and find it yourself. Okay, and I always love this slogan, Lindung diri, lindung semua. Okay, so those that haven't actually registered, ask your moms, ask your dad, because the second phase is starting. Those are for the elderlies or those with chronic diseases. Do get themselves registered and vaccinated, hopefully soon. Because as of yesterday, I think there are about 7 million people registered already in my Sejahtera. Hopefully that number will go up drastically soon. Okay, next would be the perineum massage. Okay, this is something new that I've introduced of recent years. Okay, what is perineum massage? I'm not going to do a demonstration here, no demonstration, just look at the diagrams down here. Okay, mainly is to increase the elasticity of the perineum during birth. So the perineum elasticity means it can stretch better. Okay, so it doesn't tear that easily. What we can use is olive oil, coconut oil. Okay, the person that taught me this, actually said some oil that you can put in your mouth, you can put in the perineum. Okay, do it about 10 to 15 times daily. Okay, you can do it on your own or with a partner. Okay, just want to share with you. Okay, this is a perineum. Basically, you're doing it from 3 o'clock to 9 o'clock, 9 o'clock, 3 o'clock. No need to go this way, huh? No, no need. Okay, can't as well. Okay, and while you're doing it, you stretch it a little bit. Okay, and make sure that your nails are cut. Okay, if not, it's going to be sore. And also, like I've mentioned to some, I mean, nowadays, probably a lot of people, they have gloves, those latex gloves at home. Do it with the latex glove. Oil and latex glove, they are very smooth. Okay, they're very smooth. So, so probably it actually avoids a lot of abrasions. It can be from, you can do it on your own, or you can do it, your partner can do it for you. Okay. Okay, preparation for the third trimester. Make sure you know your EDD. Equip yourself with lots and lots of positivity and confidence. Make sure your delivery bag, hospital bag is ready, and your doctor is around. At least for the past year, I don't think that any doctors are traveling overseas. And make sure your partner is not around, not on some business trip or golf trip or anything. Okay, this is the delivery bag. Either have a duffel bag, or this is a small suitcase. I think the next two slides is, oh no, that was the previous one. Now mine, let's go back. Okay, what you can have in there, okay, a change of clothes for you to discharge when you discharge home, a set of clothes for your baby to discharge home, some toiletries if you don't want the one the hospital brings, offer you, sanitary pads, okay, you can bring your own. Breast pump if you want, okay, but do not bring milk bottles, milk powder, okay? You try to breastfeed your baby. If you're unable to breastfeed, I think most hospitals, they do have the ready to feed, okay? The liquid formula all the way from the factory. What the nursery nurses need to do is just to warm it up and then cup feed your baby, okay? If baby needs a little bit of top up, all right? Okay, and the next embarrassing question is that some they may ask down there, too shy to ask, but never mind, let me share with you. To shave or not to shave down there, okay? Personal preference, okay? You can choose to shave, you can choose not to shave, okay? But I would say do not shave, do not use this sort of shave. I can't find any better ones. You only find this one, but try not to use this. This sort of shaver, it may break the skin, and if the shaver is not clean, and also perineum is not the cleanest place, okay? You may cause infection. So if you want, you can either go for a Brazilian wax or trim it, okay? It does not affect the birthing process, to be honest. And if there is a tear, it does not affect the stitching or the suturing, okay? So no worries about that. Me personally, I can't vouch for my other colleagues, okay? Me personally, I don't really mind. You want to do it, you don't want to do it, okay? If you want to do it, you can do it probably at about like 36 weeks or so. Do not wait till too late. I remember certain moms is like, yeah, doctor, I'm so sorry. I meant to go for my waxing 2 days later, but today I'm here in labor. And I say, it's okay, don't worry. All right, now you can save more money. No significant on the effect of healing, okay? Whether or not you shave or not, it will heal as well as non-shave or not non-shave as well. And the only thing is probably it's less messy during the postnatal period. After birth of the baby, delivery and all, there'll be a little bit of blood down there. So if there's not too much pubic hair there, probably it's easier to wash and all, okay? So I think that's the only maybe mini plus point there only. Okay, should I have an enema, okay, before I birth my baby? So it's not medically indicated, okay? Again, I don't do it routinely from the mom. And most of the time, if I were to do it also, the moms, they request for it. Then I'll ask my midwife, yeah, give them one to do it. If they feel very strongly about it, some is like they're very, some moms are very particular about it. They may feel less confidence if they think that they may be pooping while they are birthing the baby. So it's okay. It's not going to affect the process of labor. Studies have shown. and usually done earlier in the labor when you're probably about 2, 3, 4 cm, and we usually don't do it when you're like 8, 9 cm already, okay, because we don't want you to poop while pooping the time, birth the baby in the toilet bowl, okay, that would be catastrophe, okay, may go on the newspapers and all. Okay, next. Okay, delivery suite, labor room where you're going to birth your baby. Most of the places, I think nowadays in public or private centers is single occupancy. I remember during my first day, the first labor room that I walked into, okay, it was a shared room, very big room, 4 beds there, and just a curtain only, like what we are seeing in our consultation room, the curtain. So, and it's quite near as well. So if you were to put your hand out, and then you may be holding the other laboring women's hand, okay? So a companion can accompany you in there. Most of the time would be your husband or partner. Some, they don't want to go in or they're unable to be there, the mom will go in, okay? This is where the delivery is going to take place, the birthing of baby is going to take place, and it's limited access. Only the doctor and the midwives will be in there. Even the janitors also, we don't allow them in unless it's absolutely necessary and with the mom's consent. Okay, this is an example of our delivery suite upstairs. Okay, this is a nursing counter. Okay, and there's a 4 room in there. So one of the room is like this. Okay, we do have our yoga mat and gym wall in there as well. Okay. Okay, how do I know when I'm in labor? As you can see, this arrow that I use here, it's not only one side, it's not this side, it's not that side. It can be 1, 2, 3, it can be 3, 1, 2, it can be 2, 3, 1. Okay, it can happen at any random order. So whenever you are having contractions, the tightening, okay, if it's regular, if it's happening every 5 to 10 minutes apart, and I always tell my mom, if you're talking halfway, you're doing something, when it comes, you need to stop what you're doing, pause for a while to breathe, and stop talking. You say, oh, wait, don't talk to me. I think that's the time that probably you should start timing, okay? And very likely you may need to probably get into the hospital soon, okay? Water break, okay, can't show you anymore. Sometimes it's really like waterfall, okay? You can just wet the whole floor and show, okay? It's not a cabaret show, but I can't show you the real thing. It's going to be a little bit, some people have some aversion, okay? So if you have any of the show, the birth show, do take a photo, send it to your doctor if you have the number. And when the water breaks, clean up, wear your pad, inform your doctor, and get yourself into the labor room for checking. Okay, this is a contraction timer that I've mentioned, okay? You can download it. It's a free app. It comes with multiple languages. So just download it and start tracking when the contractions are stronger. And do screenshot this and send it to your doctor. So most of my moms, they will send me this and I know what they're talking about. Okay, rather than just tell me, oh, yeah, it's painful, how painful, don't know, doctor. So this is very objective. If I say that, oh, it's every 5 minutes once, and each time lasting about almost a minute, it's like, okay, I think you should start making your way in. All right. Okay, okay, these are very academic. Just go through quickly. Early labor, active labor. Early labor, from the beginning of the labor up to 3 cm dilated, the cervix. This one, you can monitor either at home. If you're confident enough, you live nearby the hospital. If you live far away from the hospital, you can choose to just monitor in the normal ward. If it's active labor, from 4 cm until the birth of the baby and placenta. This one, usually, we will keep the mom in labor room, okay, at this point, because you need closer monitoring. Okay, stages of active labor itself, meaning from 4 cm and above till 10 cm, that's called first stage. Second stage, from 10 cm, you're able to birth your baby, bear down, push your baby out, ready. This is second stage. And third stage is after the baby is out, probably the cord is cut, the delivery of the baby, from delivery of baby till the delivery of the placenta and membrane. Okay, So during labor, some labor may be quick, like the one that I had last night was quite quick. First time mom, she came in at about like 2 a.m. and before 5, I've completed the whole birthing process and done with the cleaning up and all those things. I was at home already. So it was really quick for her. But certain moms, they may come in and stay on, drag on for like 12, 24 hours. Okay, so during this marathon period, okay, yes, hospital do provide food to you, but do pack a little bit of your snacks. Sometimes you may not like the hospital food. You may not like the rice, the porridge, the soup. Okay, whatever you want. Juices, a little bit of bread, cookies, granola bars, nuts, dates. These are good stuffs. Okay, it gives you energy. So modern childbirth is that we don't starve you anymore. Okay, you are able to eat and drink. Like the low risk labor, eat and drink because you do need that energy. Okay, while you are birthing your baby. Okay, and if you are starved, you're ketotic, you're dehydrated, labor would not progress. Okay, the contractions may not be good. Okay, all right. Talking about food, while you're waiting to dilate, you will hear your midwife or your doctor saying, it's like, oh, 1 cm, 5 cm, 8 cm, oh, 10 cm already. What are they talking about? Okay, put the finger in and then can get 4 cm. Okay, so basically when we do a vaginal examination, we are checking the dilation of this cervix. So, well, you can see 1 cm is as big as this. Probably I can just put in one finger. 2 cm, 3, 6, donut, bagel, as big as that. Okay, meaning the bagel, if you can imagine, a normal bagel is the size of the baby's head already. All right. So during the first stage of labor, from 4 cm to 10 cm, there'll be a lot of monitoring done. Drink plenty of water, I've mentioned around. Move around. We'll be encouraging you to bounce on the ball, use the yoga mat, keep yourself upright rather than just lying on the floor. Pain relief, relaxation method, support, which I'll go through in the subsequent slides. Okay, for pain relief, most moms from the beginning, if they are feeling that they are unable to cope, there's option of pethidine injection. Okay, this one may cause a little bit of drowsiness. Some say it may pass to the baby. Yes, small amount. It may cause baby to be sedated a little bit, but if it's used probably at least like 3-4 hours before the birth of the baby, the effect may not be strong. The effect is strongest probably within an hour to 2 hours of the administration, but it does not have any life-threatening effect to the baby. Okay. All right, inhalational gas, laughing gas, we call it Antonox. It's a mixture of air and also nitrous oxide. And epidural, this is administered by the anesthetist. Okay, this one usually will numb off the lower half of the body. And with epidural, you may not be able to mobilize or use the ball. So epidural, if you really need it, I'll advise you probably push it later on first, because we're encouraging you to move around so that with the power of gravity, baby is able to descend better. Complementary, bring your music in. Okay, I mean, you can just bring something like a small, this sort of wireless speaker. Get some massage oil. Your hubby can massage for you. Aromatherapy, bring a diffuser in. Diffuse your favorite scent. Okay, choices of pain relief, epidural, anesthetist, it's at the back. They'll poke the needle and put the catheter into the epidural space. Antonox, inhalation is something like this. Well, injection, everybody knows what's that. Okay, position to adopt. Okay, use the gym ball, keep yourself mobile. I think whatever you can see here, it's available in any normal labor room. Okay, do some squatting, open up the pelvic floor. Power of gravity, like I said, will push the baby down, and emotional support is very, very, very important from the husband or the birthing companion. Okay, monitoring of baby's heartbeat, CTG, which I'm going to show you next. Normal tracing, abnormal tracing. You don't have to read this, but you will be seeing, we'll be doing this from time to time to make sure that the baby's heartbeat is normal. Okay, second stage of labor. Hospital birth, something like this. Home birth, no, I don't encourage this. Okay, cannot lah. It's just not safe. Water birth is being stopped in Malaysia for various reasons. So at the moment, we don't have it anymore. So it's mainly hospital birth. This is the delivery set, just share with you. This is not a delivery set that I use in my labor room, but because this color looks very attractive, that's why I use this. Probably next time I'll try to take a photo of the delivery set that we have in our own labor room. Okay, next topic is episiotomy. Episiotomy is basically what we call the cut. Okay, so you can see the husband is like, what are you going to do to my wife? Okay, so it's about 3 to 4 cm cut at the opening of the vulva. Okay, the reason is to make space for the baby to come out and facilitate the insertion of the forceps or vacuum cup. Okay, I'll go through later on. Local anesthetic injection will be given prior to this procedure and during the repair as well. And not everybody needs an episiotomy. Okay, I believe that episiotomy, it's only needed when all else fails. Okay, even for me, normal first-time birth, subsequent birth, birth using instrument, vacuum, or even forceps, sometimes you don't need to do a episiotomy, and you may not end up with any tear. Okay, the lucky ones, I'll say probably 10% to 15% may not end up with any tear. That brings us back to perineum massage. Okay, do more of it, cause more elasticity. Make the tissue more elastic at the perineum so that it may minimize tear, or if there is any tear also, it's just very minor. Okay, so most of the time we'll cut over here if it's needed. All right, I would say for first timer, I would only do it probably less than 5% of the time. Like I said last year, I've only done one. I said it too soon. In December, early December, I've not done any in 2020, and then a week later I have to do one. Okay, but subsequent pregnancy, no, you don't need it. So if you have fear for this and all those things, discuss with your doctor. Not everybody needs it. Don't get talked into it. Discuss with your doctor about your birth options, what you feel like it. Instrumental delivery, okay, like I've mentioned, vacuum, forceps. It's done only indicated only like a few conditions only. Not everybody needs it one. Okay, if someone has been pushing and then baby's heartbeat start to drop already, okay, and we cannot wait for 1 hour for the baby to come out. We don't want the baby to be hypoxic, go on without oxygen and all, then we may need to do it. Prolonged second stage, the mom has been like bearing down for the past 60 to 70 minutes already. It's still no sign of baby's gonna come out anytime soon, and mom is already exhausted already by then. We may offer a vacuum delivery. Usually a verbal consent between the doctor and the parents will suffice. And which one to use depending on the doctor and the condition, okay, at that point of time. Okay, cesarean section indicated for this emergency, fetal distress, baby passing meconium pooing inside the womb far too early, okay, and poor progress of labor, meaning the cervical dilatation stuck at certain dilatation far too long. Stuck at 4 cm, 5 cm, after 4 more hours, still 5 cm, then give 2 more hours, 6 cm, then just stop like 4, 5, 6 only. It never progressed up to our bagel, 10 cm. So that one we may need to proceed with an emergency cesarean section for failure to progress. And then indication for elective cesarean section, suspected big baby, very contentious. What baby is big for what mom? Okay, like certain moms, they're like like now I have a mom in labor upstairs. She's 173. She's very tall. Okay, so a 3.6 kilo baby is not big for her, as compared to a mom who is like only 148 cm. Even a 3.3 baby is big for her. Okay, so placenta previa, low-lying placenta. Placenta is covering the opening of the womb, so no way that baby can come out safely. Bridge baby, or those especially preemie. After 2 or more cesarean sections, certain maternal condition like severe heart diseases that may preclude the mom from bearing down too strenuously, and also more and more people are choosing for horoscope baby for their own reason. Okay, so I'm coming to one of my last slides already. Another thing is that once the baby is out, okay, usually we'll put the baby on the mom's chest or tummy, depending how long the cord is. Okay, then we'll cover the baby. We'll encourage skin to skin bonding. Usually that will happen. I mean, skin to skin bonding. I'll just allow 20-30 minutes. Okay, if baby is fine, mom's okay with it. Okay, delayed cord clamping. WHO has actually suggested up to 2 to 3 minutes, okay? If the baby is well. If the baby needs resuscitation and all, I'm sorry, we need to clamp the cord and cut it immediately. Okay, 2 to 3 minutes later, then I'll invite the dad to cut the cord if he wants it. Okay, this is to reduce the incidence of anemia in the newborn, okay? Reduce the chances of baby having low blood. And also, if you prolong it for too long, okay, you go on like up to 10 minutes, someone's like, no, don't cut. I want to wait till the pulsation stops and all. It may actually cause neonatal jaundice. Too much blood gone into the baby, and baby needs to break down a huge amount of blood cell, and that may lead to jaundice. Okay, so usually 2 to 3 minutes. Usually I keep 3 minutes, we're safe. Okay, third stage of labor. It's from the delivery of the baby to deliver a placenta. This is a time when we will offer the mom an injection on the thigh, oxytocin. It's a medication, okay? It's not going to harm the baby. Baby's out already. Not going to harm the mom. It's to help the mom to contract the womb, okay? This is a time when breastfeeding, skin to skin bonding should commence. And this is the time that we monitor the baby. Usually after the birth of the baby, third stage, we'll monitor the mom in labor room for about an hour or so before we transfer the mom back to the room, back to the normal ward, and then probably stay for at least 12 hours or overnight. If everything's okay, baby's okay, mom's okay, we will discharge them home. Okay, thank you very much, everybody. And this is my Facebook page. If you haven't checked it out, go check it out, like it. Look at some of the pre-recorded webinars I've had in there. Something on preconception counseling, first trimester webinars, topics on postnatal confinement, and also there's one on labor ward tour, okay, and a chat with midwives as well. So there are a lot of things in there. Go and check it out. I think that's all for now. Everybody, stay safe. Keep your distance, okay? Wear your mask. When you have the time, register in your My Sejahtera app, and all the best in your pregnancy, okay? Lindung diri, lindung semua, okay?